From the PEP Radio Newsroom, this is the Hourly News Blast. LGBTQ Nation is reporting data from researchers working with children who acquired HIV from their mothers through pregnancy, childbirth, or breastfeeding has shown that the antiretroviral drugs administered earlier in their lives is having an unexpected outcome. The virus is undetectable in their bodies even after stopping the therapy. A recent study by University of Oxford pediatrician and immunologist Philip Goulder describes how 5 children among a larger group remained in remission despite not receiving regular ARV therapy for an extended period, in one case up to 17 months. Those children in a larger group from South Africa had failed to show up for continuing treatment. When they were tracked down, researchers found them to be perfectly healthy. Instead of their viral loads being through the roof, they were undetectable, Goulder told Wired. And normally, HIV rebounds within 2 or 3 weeks. Goulder's findings were supported by data presented at the International AIDS Society Conference in Rwanda in July by Alfredo Tagaro, a pediatrician at the Infanta Sofia University Hospital in Madrid. His study showed that around 5% of HIV-infected children who receive antiretrovirals within the first 6 months of life ultimately suppress the HIV viral reservoir to negligible levels. The viral reservoir is the number of cells harboring the virus's genetic material. Children have special immunological features, which makes it more likely that we will develop an HIV cure for them before other populations, Tagaro said. Kids have a much more dynamic immune system, said Mark Cotton, who directs the Children's Infectious Diseases Clinical Research Unit at the University of Stellenbosch, Cape Town. They also don't have any additional issues like high blood pressure or kidney problems. It makes them a better target initially for a cure. Cotton suspects that between 10 and 20% of all HIV-infected children would be capable of controlling the virus for a significant period of time after stopping antiretrovirals. The consensus comes as a number of new and potent HIV therapeutics come online, including so-called BNABS, or broadly neutralizing antibodies, which can recognize and fight many different strains of HIV, as well as stimulate the body's immune system to destroy cells where HIV is hiding. There are also therapeutic vaccines in development that can train the immune system's T cells to target and destroy HIV reservoirs. If children are already responding well to retroviral therapies, the addition of these new lines of attack could eradicate HIV in their bodies altogether, Goulder said. We think that adding the effects of these broadly neutralizing antibodies to antiretrovirals will help us chip away at what is needed to achieve a cure, Goulder said. Curing HIV probably requires a few hits from different angles, impacting the way that the virus can grow and tackling it with different immune responses at the same time to essentially force it into a cul-de-sac that it can't escape from. Both Goulder and Cotton are ramping up studies to attempt just that. Researchers have recognized the special ability of children to fight off the virus since isolated cases emerged in the past decade. In 2013, the so-called Mississippi baby acquired HIV in the womb and was given aggressive antiretroviral therapy. At 3 years old, she showed no active infection despite stopping therapy 18 months earlier. The case of a South African child was revealed in 2017 at the International AIDS Conference in Paris. The child was born to an HIV-infected mother and given ARVs starting at 8 weeks old. As part of a controlled clinical trial, the treatment was stopped at 40 weeks, and more than 8 years later, the virus hadn't rebounded. That's the News Blast at this hour. Starting tomorrow through Friday, August 15th, Pennsylvania Equality Project and PEP Radio will participate in Crawford Gives Days. This is our only major fundraising event for this year. Every dollar we raise will be used to support the various programs we run. For details, visit the PEP Radio page at paequality.com. Up next, we have the Meadville area weather forecast here on PEP Radio.